Hello, my name is Dr. David Pratt and I'm the Commissioner for Public Health Services for Schenectady County. And I wanted to take a few minutes of your time today to talk about the H1N1 influenza disease that is currently going across the country and across the county. You know, it's possible that some of the experts have underestimated the severity of this particular illness. We know nationally that as many as 86 children have died and 28 women who are pregnant also have died from influenza. We also know there have been deaths here in the state of New York. And of course, the best thing for all of us is not to get the flu at all. And the best protection against influenza is to get the flu vaccine. Now, there's been a lot of controversy about the flu vaccine, but there have been thousands of people who tested the vaccine for us, and we know that the vaccine is both safe and effective. And I believe so fundamentally in the vaccine that I had a shot myself just last Friday. So I would encourage those high-risk persons in the county, especially pregnant women, and the parents of children to make sure that they get immunized when the vaccine is available. And I know it's discouraging because the vaccine has not been readily available yet. And the vaccine supply is slow and not coming out to the extent that we wanted to, or you wanted to either. But we'd like you to be patient with us as the vaccine does become available. And while you're being patient, please remember that there are some important strategies that you can do before we get vaccine. You can wash your hands frequently during the day with soap and water, or if soap and water is not available and your hands aren't soiled, you can use the alcohol rubs that are very effective. Please make sure that you and your children cover their coughs and your cough with your sleeve or with a tissue, and then dispose of the tissue rapidly and wash your hands if you are sneezing or coughing. And remember, if you have fever and sore throat or cough, please go home from work or school or stay home if you're at home, and don't return to your usual activities until you've been free of fever without medication for 24 hours. And parents who are concerned about getting vaccine for their children need to know a couple of things. Number one is that by being persistent and contacting their pediatricians or family practitioners on a regular basis, you'll be able to get information from them. We expect that this information will also be in the local newspapers, and please remember at www.schenectadycounty.com we'll post information there as well. And pregnant women, we want to encourage you, please, to contact your obstetricians and stay aware of the fact that there may also be clinics for pregnant women that are offered in the county sometime during the early weeks of November and early December. In spite of all you've heard and read about the influenza virus and this flu season, I wish I could tell you it's going to be over soon, but I think that's unlikely. I think more realistically, we're likely to see 6 or 8 weeks of persistent influenza activity here in the county and across the state of New York. So those measures that I just talked about in terms of covering and hand washing are very important to maintain as these weeks and months go by. Please make sure you take full advantage of the information that we're posting on the Schenectady County website. That's www.schenectadycounty.com. You'll also be able to get authentic and accurate information from the New York State Department of Health and from the Centers for Disease Control. So by taking advantage of vaccine when it becomes available and using hand washing and covering coughs and staying home or going home, I hope we can keep the flu away from you. Thank you very much.